Hey, this is Dr. Scott Worden, the TOS guy, and we are live streaming from beautiful Sunnyvale, California. I hope everybody is doing well out there, and I thank you all for either attending the live stream or for viewing it after we put it up later. Our website is www.tosmri.com, and we're always growing and changing it, and this is one example. We published a blog post recently about Victor Wembanyama titled, "What Happened to Victor Wembanyama?" Now, the NBA Finals just finished, and Tyrese Halliburton on the Indiana Pacers suffered a game-ending and season-ending injury during the Finals Game 7. And while that had a direct effect on his team, the Pacers lost to the Oklahoma City Thunder, some people have argued that a much more impactful injury over the course of the whole season was the injury to Victor Wembanyama. Now, this one struck me as interesting because it's right up our alley. It's a blood clot, and it's a blood clot in the arm. But as I read the mainstream media, I found that it was quite confusing. First of all, if you didn't know a lot about TOS, which I suspect this young man has, you would be confused by all the words about blood clot and deep vein thrombosis and pulmonary emboli. Plus, there are many other NBA players who have suffered from blood clots of various types, as well as other athletes, such as, I believe, Serena Williams. But what we intended to do with this blog post was to raise the question of what was going on with Victor Wembanyama, then describe in detail what a blood clot is, because there are many types of them, discuss some of the other athletes who had these blood clots, and in the end, I provided my personal opinion and reasoning why I think Victor Wembanyama actually is diagnosed with venous thoracic outlet syndrome. Now, that's just my opinion. I'll preface the whole thing by saying I have not provided care for Victor Wembanyama. I've not been in contact with him or his management team or his trainers. So I don't know anything firsthand. I'm just using this as an example to educate and illustrate and hopefully spread awareness about athletes and this particular problem of venous TOS. So let's get into it. His injury was in February of this year. And at the time, mainstream media, who are not doctors, quoted a bunch of things. I'm going to read some of those. Wikipedia, which has been kept pretty current for a guy who's this famous, described it as deep vein thrombosis in his right shoulder. The NBA.com website said, the San Antonio Spurs today announced that Victor Wembanyama has been diagnosed with deep vein thrombosis in his right shoulder. Pretty similar. ESPN.com said Wembanyama will not play for the remainder of the 2024-25 season due to deep vein thrombosis in his right shoulder. I think they're all cribbing from each other. SI.com, the former will be sidelined for the remainder of the season after being diagnosed with deep vein thrombosis in his right shoulder. USA Today said something similar, although they used the words blood clot. Now, I read this stuff, and right away, the bells went off in my head. Deep vein thrombosis doesn't typically occur in the upper extremity, except in very certain circumstances, and I'm going to describe that in a little bit. But what I will note is that a sports writer for Yahoo Sports by the name of Tom Haberstroh, I hope I'm pronouncing that correctly, in February 21 of this year in particular, he started looking into the deep vein thrombosis issue. And very cleverly, he added up the miles of travel of all these different NBA teams, and he found that the Spurs had traveled the second most of any team. So a lot of lay people know that when you take a long plane flight, you can develop a deep vein thrombosis or a blood clot in your legs. So that's how he started out. And I'm reading that and saying, no, I don't think you got this right. But without any prompting from me, Mr. Haberstroh very cleverly persisted in his investigation, for which I'm grateful, because this kind of thing raises awareness for everybody. And since there are so many sports fans, many more sports fans than number of viewers on a TOS channel, this is important because athletes are getting diagnosed more and more frequently with TOS of various types. But what he did was, after he drew a chart showing the travel, he contacted a Brian Sutterer, a sports injury physician who's fairly well known. And Sutterer said that overhead motions, like shooting a basketball, can create what's called thoracic outlet syndrome, which occurs due to repetitive compression and stress on the vein below the clavicle. So that was neat, because I agree with Sutterer. This is the shooting arm of a guy who probably practices 1,000 shots a day. The New York Times in April, specifically April 3rd of 2025, they actually published a nice article called Doctors Explain DVT, the blood clot affecting Damian Lillard and other NBA players. And they revised it again on April 21. I read that article with interest, of course. They first talked about DVTs coming from the lower extremity more than the upper extremity, and how they can lead to blood clots in the lung, which in young, healthy people is an unfortunately more common cause of sudden death. So we do have to worry about blood clots forming in the legs or the arms. They noted in the New York Times article the risk factors such as long plane trips, using non-steroidal anti-inflammatory drugs like Tylenol, ibuprofen, Motrin, which is not something I had heard of before, dehydration, or repetitive motion and contact. Now, they didn't separate out the upper extremity and lower extremity in this risk factor list. They did interview a Christopher Yee, a doctor in Southern California, who's a vascular surgeon. And because he's a vascular surgeon, probably has some exposure to TOS, because he did mention TOS and he mentioned Markel Fultz. We published a blog post several years ago on Markel Fultz because he was diagnosed with, I believe, neurogenic thoracic outlet syndrome. But I've never seen really confirmation of that. And I believe since that point, because he struggled and was traded from his original team being the first overall pick in the draft to the Philadelphia 76ers, he was traded and he hasn't done as well as his promise originally. I believe that a lot of management teams for these athletes are now shying away from using this diagnosis. So he's never been diagnosed publicly, as far as I know from searching the web, but that was his original diagnosis. Anyway, they talked a bit about treatment, and they made some separation between upper extremity and lower extremity blood clots, which is important. Now, I'd like to go into further detail on what causes blood clots in the bigger picture, anywhere in the body, and what the differences are between lower extremity DVTs or blood clots, upper extremity DVTs, deep vein thrombosis or blood clots, and pulmonary emboli, which are also blood clots. And there are some very important differences. But let's go back, way back. There's a guy named Rudolf Virchow. I believe he was called the father of modern pathology, and he created the triad of blood clots, the three causes that have to be disturbed to develop blood clots. One is stasis, or slow blood flow. As the blood flows through the vessels, arteries rarely get blood clots because of fast blood flow. Veins more likely get blood clots because of slow flow, especially in certain areas, or if they're obstructed or compressed. The second part of Virchow's triad is hypercoagulability. That means the blood clots too easily. In everybody, you want the blood to clot if you get an injury or a cut, but you don't want it to clot so easily that the blood flowing through the veins just slows down and forms a blood clot. So there's a very complex system of blood factors that regulates how easily the blood clots. And then in addition, the lining of blood vessels, called the endothelium, has mechanisms to keep the blood from sticking to the walls and clotting. That's the third factor, endothelial injury. So Virchow's triad is stasis, or slow blood flow, hypercoagulability, or easy clotting of the blood, and endothelial injury, or damage to the lining of the blood vessels that no longer protects the blood vessel from forming a clot. Now, of all blood clots, the vast majority will form in the legs. Only about 5% of these DVTs, or deep vein thromboses, form in the upper extremity. But let's take that small segment, 5% form in the upper extremity. The causes of these are 70%, about 70%, are caused by cancer, prolonged immobilization, let's say after surgery, pregnancy, or use of oral contraceptive agents such as estrogen. Only a small percent, maybe 5% of the 5% of blood clots that do form in the upper extremity are actually due to venous thoracic outlet syndrome. So when you see a blood clot in the upper extremity, it's unusual. When you see venous TOS, it's even more unusual. But it does tend to occur in athletes or people with a lot of repetitive motion. Now, pulmonary emboli, we're going to talk about separately. They are not blood clots that form in the lungs. They are blood clots that form most often in the lower extremity, and pieces of them can break off, travel through the heart, and then block the blood vessels in the lungs. And this can be very serious, even fatal, depending on the size and number of these blood clots. But pulmonary emboli, PEs, do not form in the lungs. They come from somewhere else. If you have a patient with lower extremity DVTs and a patient with upper extremity DVTs, the one with lower extremity DVT is much more likely to have a pulmonary embolism. So one of the questions we get asked from our patients who have venous TOS is, am I at risk for this pulmonary embolism? And the answer is it's a very low risk. Many patients who get venous TOS, and it's quite rare to get pulmonary emboli. Going back to my notes, forgive me for a second. All right. When you do have an upper extremity DVT, I wrote down some of my notes here that I'll read it to you. Although patients with venous thoracic outlet syndrome comprise only 5% of the total group of patients with upper extremity blood clots, these patients were significantly more likely to be male, to be younger, and to have their first episode of blood clotting. So remember I said a little while ago that 70% of upper extremity blood clots are caused by things like cancer or prolonged immobilization. Compared to that group, which the average age is 57 years old, the patients with upper extremity blood clot who are caused by venous thoracic outlet syndrome, let me clarify that, compared to the 70% of patients who have a known cause for upper extremity blood clot, the age of those patients is 57, whereas the age of those caused by venous TOS is 37. They're significantly younger. They're more likely to be male, and it usually shows up as a first-time event, whereas patients who have prolonged immobilization may have several episodes of blood clot, and they have to be treated carefully for that. Now, in high-level overhead athletes, we know that the veins get compressed repetitively. And in the case of a basketball shooter, you might expect, if we had enough numbers, that over time, you would find those with venous thoracic outlet syndrome would be more likely to have it occur in the shooting arm, the right arm if they're right-handed, the left arm if they're left-handed. No one has studied this. There aren't enough numbers of these elite players to really get a good grasp on that, but it fits the whole picture. So just to review, there are blood clots in the legs, there are blood clots in the arms, and there are blood clots in the lungs. And any of these mainstream sports articles that described blood clots in NBA players, it's not that simple. If you go to our blog on tosmri.com, you'll see that I list a bunch of NBA players who have had blood clots, and the vast majority of them were either blood clots found in their legs or blood clots found in their lungs, which led to a search that led to the legs. And only one significant player actually had venous TOS. Remember, there's also Markel Fultz who may have had neurogenic TOS, a different issue from what we're discussing now. So in the end, without knowing anything specific about Victor Wembanyama, here's my reasoning why I believe he has venous TOS. Number one, he clearly has a confirmed blood clot in the upper extremity. And those don't occur except very rarely. Remember, 5% of all blood clots are in the upper extremity, and 5% of those are venous TOS. So it's unusual for it to occur. Wembanyama has none of the typical risk factors for an upper extremity blood clot. He's not pregnant, obviously. He doesn't have cancer, and he doesn't have prolonged immobilization following surgery. Number three, patients who present with upper extremity DVT caused by venous TOS are younger, they're male, and this is usually their first episode, so he fits those criteria. Venous thoracic outlet syndrome is known to occur in people with stressful, high force, high frequency upper extremity motion with the arms above the head, such as swimmers, tennis players, volleyball players, some water polo players, rock climbers, baseball pitchers. Next number, Wembanyama's clot is in his right arm, right shoulder, right thoracic outlet, and he's a right-handed shooter. It's a weak factor because so many people are right-handed, but I believe it contributes to the overall picture. And then blood clots in the shoulder are not typically associated with long airplane flights, so we're not looking for that as a risk factor. So as I said, I believe, and I have believed since the beginning, that he, Victor Wembanyama, has venous thoracic outlet syndrome. We do know, in short follow-up, coach of the French national team on which Wembanyama plays has said, yeah, he's had surgery, he's recovering nicely. But Victor's management team is not saying anything about treatment or surgery. So if he has in fact had surgery, as his coach of the national French team has said, it could be two types of surgery that I can imagine. Either they went in and actually removed a part of the first rib, which would be appropriate depending on what you find on imaging, or maybe they put a stent in place, a metal cage to keep the vein open. Now, the first step when you treat this venous TOS is you want to dissolve the blood clot. Some people will use an anticoagulant, which slows down the blood clotting and allows the body to dissolve the clot. Other people will use thrombolytics, which actually actively goes in and dissolves the clot beyond the body's strength to do so. Then the next step is you'll usually do a venogram, where you'll inject dye into the arm and you'll follow it through this area of narrowing in the thoracic outlet, and you'll make sure that now that area is clean. Now you're also looking to see if the underlying vein has been damaged. So sometimes there will be a web or a stenosis or a scar of that vein. If that's the case, they will go in with a balloon angioplasty. It's a very small plastic catheter. You can inflate a balloon and stretch the vein to get rid of that narrowing. And sometimes people during that same kind of procedure will put in a metal cage, a stent, to keep it open. But if the underlying rib and clavicle are too close with arm motion, then it's going to squeeze that cage or that stent, and you'll just get recurrent blood clots. So I suspect he's either had surgery to remove part of the first rib, or the surgery described by his coach is to go through the vessels and to remove the clot and to put a stent in place. And having said that, I'll ask each of you, if you're interested in this topic, go back to our blog page and read the article. Shoot us questions if you want. I think I left comments open at the end. Now, if we have any questions, I'll be glad to take them. And if we don't have questions from our viewers, I'm going to say thank you for your attention and your time. Join us at our next event, which is a patient journey. That'll be September 16th of this year. One of the patients that we've helped get through this through successful treatment. And we always think this is valuable because there are many components to this, but besides the physical component, there's an emotional component, and everybody has their own story. And these parts of it, the emotional parts of it, how to deal with the disease, how to build and maintain your support group, are equally as important as the treatment for most people. So I thank you again. This is Dr. Scott Werden, the TOS guy. Read our blog post on what happened to Victor Wembanyama, and we'll see you next time.